Let's return to one of our top stories this morning, the dire situation in Ontario hospitals as this third wave of the pandemic reaches new record highs. Take a look at this. It shows you very clearly on a graph the record number of patients now in critical care in the province, all the way up to 605. And as you can see, because you see the first and second waves prior, that is the most since the start of the pandemic. More than a year ago, hundreds more than the last peak in January if you move to the left, and new orders are in force now that allow hospitals to keep beds open for COVID-19 patients. Elective surgeries now canceled with the exception of the northern part of the province. Patients can be moved without giving their consent in extreme circumstances. There's another emergency order that allows healthcare workers to be redeployed to hospitals in need of extra staffing. We're going to look at this in more detail with Dr. Jamie Spiegelman, who's an internal medicine and critical care specialist at Humber River Hospital in Toronto. Dr. Spiegelman, welcome back to our program.
Thanks for having me, Heather.
Well, I'm really interested in your take on all of this, and maybe we can bring back that graph because I know you were looking at it, and you can see it first wave, second wave, and then right off the chart there. As you look at that graphic depiction, 605 now in ICU beds in Ontario, what's your reaction to that?
Yeah, it's definitely true. Every wave has been different. This wave is clearly more larger, it seems, for sure. And it just does seem like that from the front lines, for sure. Like we're having two real big challenges right now with this third wave. One being the number of patients, like depicted on the graph. The other one being enough staff to take care of these patients, particularly nursing staff.
Okay, so let's break those down. Let's look at each of those separately if we could. In terms of patients, as I was mentioning, there's that order now allowing for patients to be transferred out of hospitals to hospitals where there might be space. At your particular facility at Humber River, have you had to yet transfer anybody out?
Yeah, so for the last 2 to 3 weeks, we've been transferring anywhere between 2 and 10 patients a day to other hospitals.
A day?
A day, yeah. So two on life, usually on average 2 on life support and another 5 to 10 not on life support to other hospitals who are on the medical wards. So we're for sure neck deep into this third wave for sure at this point.
Neck deep. That is a really good description, a visual of all of that. So the patients are transferring, and just so everyone realizes, this is the first time in the course of the pandemic that Ontario has made this order to transfer patients out. What about staffing? As you said, it is critical as well. What's the situation?
Yeah, so definitely one of the biggest challenges we've had, and many hospitals in the GTA and Ontario are having enough nurses to take care of these patients. There's some hospitals where underused doctors are even helping the nurses taking care of these patients from a nursing standpoint. So there's definitely a nursing shortage for taking care of these patients at the bedside. So that's universal at this point, and we're making do, and we're using extenders from other areas in the hospital coming down, but that's also causing a domino effect. Obviously, if you're taking a nurse from a medical floor or a surgical floor or the emergency room to the ICU, obviously that's going to cause a domino effect in terms of having enough nurses in those areas as well. So we're definitely seeing that in our hospital.
So just to be clear, extender is someone coming in from elsewhere into the service to extend your capacity to care for patients there. So are you moving them from just within Humber River, or have you had to bring them in from outside your hospital? Or even, I mean, there is a push in some circles to bring them in from outside the province.
So far, we're using within the hospital system. I'm not sure what the administrative plan is to bring them from outside. I know Dr. Ford has mentioned that, and we'll see what happens. But right now, we're tolerating it, although there's clearly a shortage.
Yes. You mentioned something interesting, and certainly I've been hearing and reading reports from William Osler, notably, of doctors who would not normally be working with COVID-19 patients, getting special training to work alongside critical care nurses to shore up that nursing shortage. So how extraordinary is that?
It's pretty extraordinary when a doctor is trained all their life to do, brain surgery or gallbladder surgery or chest surgery, and now is helping to turn a patient who's critically ill in the ICU on a life support machine. So it's pretty extreme, but it's what we'll do as doctors. I think we'll do whatever it takes to help these patients.
So the worst case, as bad as it is, Dr. Spiegelman, the worst case, Ontario was already talking about this. And from the health minister, we heard at the end of last week, the province is finalizing its triage protocol, what it would have to do if the ICUs are overrun in terms of deciding who gets life-saving care and who does not. How close to that moment are we now?
First of all, I don't think any physician, anyone in healthcare wants that to happen. It'd be terrible when we're deciding who gets life support and who doesn't. That's not what our healthcare system is based on. We're based on universality and everyone getting equal care. So none of us want that at all, or even come close to that. I don't think we're that close to it at this point. I think we'll adapt as a healthcare system. We'll have these extenders. We'll bring in other people before we even come close to deciding that. And it will come down to more of a political and bureaucratic decision rather than from a healthcare provider like myself. I would never decide on giving life support or not giving life support based on resources.
I think that's what they're wanting exactly to avoid, to indemnify doctors like yourself from having to make those decisions. But I remember when they first released that triage protocol the first time back in January, and what a stunning moment it was. So I wondered if you thought it was on the verge of being brought back, given the kinds of numbers that we are seeing. You are getting set to head in for your shift on this Monday morning. Yeah. What are you anticipating?
I see the list every morning in our email, and when half the patients get admitted to our hospital are COVID patients, we know what we're dealing with this for the rest of the day. We know there's patients that we're treating all over the hospital with this, not only in the ICUs, but on the medical wards. So every day is a new day, and these patients vary. Like, I'm looking at the list, and we've had admitted patients over the last week ranging from ages of 22 to 99 with COVID. So every day is a new day, and we'll see what happens, I guess.
A new day, but is it likely to be a good day?
I don't know. We'll have to find out. Some days are, some days aren't over the last week. And, whenever you're intubating somebody in their 20s or 30s, it's not a good day.
No, and you told about that most evocatively last time you were on our program talking to John. Surely there are people who are recovering and there are people who are leaving hospital, and those are good day and good moments, I'm sure, for you. Yeah. But the strain that you are under, the strain that the system is under now, Dr. Spiegelman, have you ever experienced anything like this in your career?
Definitely not. If you asked me a year and a little bit ago what you'd be treating, I'd be treating heart attacks, strokes, the normal medical problems that we treat in hospitals. We're treating a disease that didn't exist basically a year ago. So clearly we have not been under this much strain in terms of treating a disease we don't really completely understand yet. We don't really have a magic bullet to cure this disease. And we're obviously having increased numbers of it. So it's definitely challenging for us in the hospital at this point.
And the numbers just keep going up. Dr. Spiegelman, thank you for the time today. Thank you for all the work that you're doing, and all of your medical colleagues continuing on so heroically. Thank you. Dr. Jamie Spiegelman is an internal medicine critical care specialist at Humber River in Toronto.